Hello everyone, my name is Rebecca Davis. I'm a student of the College of Public Health, and for this assignment I chose the topic of potential dioxin exposure to residents in Buchanan County. I will be representing the Arkansas Department of Health as an environmental health specialist, and on this presentation, the first slide is going to be the title slide, which you're seeing right now. So I have the title of the topic of discussion, who I am and who am I with or representing, the necessary disclaimer for UMS College of Public Health, and then the date of the assignment is going to be like the releasing date or the date of the public availability session, and I have this listed as October the 3rd, 2025. As you see, also I created a logo to help with credibility of this department I'm representing. So for a public availability session, this is when multiple state agencies get involved and they provide the community or the residents exposed update of what's going on at the site. So the objectives for this public availability session or this project or the following: an introduction. So an introduction to the site. I actually developed a name for the site that I'm going to be working on just to make it flow better. So I named it as ABC Incorporated, which is going to be a Superfund site on the national priority list for dioxin. The agency involved, so this is going to be like ATSDR, the Agency for Toxic Substance and Disease Registry, EPA, Environmental Protection Agency, and then some type or sort of Department of Health, but also the Department of Environmental Quality. The source and pathways of exposure, so the source is going to be connected to the Superfund site, but also the pathway of exposure, maybe it's this runoff. So I'm going to be working on that. I'm going to be presenting on health effects. So what are the health effects of dioxin and what does that mean in terms of your health or your family's health? How to reduce your exposure, such as not eating the vegetables if that was planting in your backyard, or washing or peeling them off, or maybe even taking shoes off outside and not bringing them inside if you're playing or your shoes are muddy or dirty. Dioxin, most likely media is soil. Next steps going to be like remediation phases. What should you expect? What should the residents expect for state agencies involvement? And then contact information. So this is going to be again for the state agencies involved, how to get in contact with them if there is any questions or concerns, and always provide a question or concern segment to where the residents can ask you questions. So that's kind of my objective that I plan on communicating and talking about. So I kind of already talked about this a little bit with the state agency involved, so it kind of goes in hand with my resources. So ATSDR, I already explained who they are, but they have a lot of guidance on chemicals and health, so toxicological profiles and tox facts. That's going to provide me information on toxicological studies and provide health education to the residents who are being exposed and how to reduce their exposures, but also comparison values for dioxin. ATSDR Public Health Assessment Guidance Manual is going to help provide resources on the steps for a public health assessment process. So that's going to be hand in hand again on communicating to the residents of the next step actions. Like this Department of Health is going to evaluate the data, and this is what the data is showing. The EPA Superfund website, this was a really great tool for me to use because I was able to find other Superfund sites with the chemical concerns such as dioxin. We have one here in the States called Vertec, located in Jacksonville, Arkansas. I kind of been researching a lot more on that and providing similar contents of information for this PowerPoint. But also the Arkansas Department of Health has a toxic chemical website that has a lot of good information in plain language. In the Arkansas Department of Health Cancer Registry website, Cancer Cluster, And so they have also a guidance manual of when they conduct cancer cluster investigation or chronic disease investigations when there is a potential risk, and that could be from a public health assessment. So all of these are really great resources that I plan on utilizing into my PowerPoint and my presentation.